Good day, I'm Raman Tuli, and today I'll be discussing the efficacy and safety of intravitreal pegcetacoplan in geographic atrophy, the results from the Derby and Oaks clinical trials. These are my financial disclosures. Dysregulation of the complement cascade has long been implicated in the pathogenesis of geographic atrophy. We do know that there is increased complement activity in the area of geographic atrophy, as well as in the area surrounding the geographic atrophy or the pre-lesion. All three complement pathways funnel through C3, and the cleavage of C3 activates the destructive complement pathway, resulting in opsonization, inflammation, and the formation of the MAC, which eventually results in cell death. Pegcetacoplan binds to C3, blocking the cleavage of C3, and thus prevents the destructive downward cascade. The Derby and Oaks were phase 3 clinical trials involving 1,258 patients, approximately 600 patients in each study at 200 sites globally. They were randomized in the following fashion: pegcetacoplan administered every month, pegcetacoplan administered every other month, compared to sham monthly and sham every other month. These are the key inclusion and exclusion criteria. However, ocular history or active CNVM was not, in the fellow eye, was not exclusionary. Primary endpoint was change from baseline to month 12 in total area of the GA lesions in the study eye based on fundus autofluorescence, and these are the key secondary endpoints. With respect to the demographics in the Oaks and Derby clinical trials, there was good representation through all cohorts. With respect to results, in the Oaks study, pegcetacoplan did meet the primary endpoint. There was a 16% reduction in GA growth in the every other month group and a 22% reduction in the growth in the Q monthly group. In the extrafoveal analysis, there was a 21% reduction in the every other month group and a 35% reduction in the Q monthly group. In the Derby clinical trial, pegcetacoplan did not meet the primary endpoint, with a reduction observed in the every other month group of 11% and a 12% reduction in GA growth in the every month group. With the extrafoveal analysis, there was a 25% reduction in GA growth in the every other month group and a 16% reduction in the Q monthly group. With the pooled analysis, pegcetacoplan did reduce lesion growth at a rate of 14% in the every other month group and a 17% reduction in GA growth in the Q monthly group. With respect to the extrafoveal analysis, there was a 23% reduction in the every other month group and a 26% reduction in the Q monthly group. In patients, an analysis on patients that had bilateral GA was done, and the growth rate was compared to the fellow eye. In the sham group, there was no difference in the growth rate of the GA, and there was a significant reduction in the every other month group with an 11% reduction in the treated eye versus the fellow eye, and a 16% slower growth in the fellow eye versus the fellow eye in the Q monthly group. With respect to adverse events, there was no systemic marker identified, and with respect to ocular adverse events, there's two areas of interest, specifically the incidence of IOI. 13 patients did develop IOIs in the treatment group. All resolved with treatment, and most continued on with treatment throughout the study. There was no evidence of any retinal vasculitis or vein occlusions in any of the IOIs. In addition, there was a 6% chance of formation of neovascular membrane in the patients that received Q monthly pegcetacoplan versus 4.1% in the every other month, and a 2.4% chance of developing a neovascular membrane in the sham pooled group. In conclusion, pegcetacoplan monthly and every other month met the primary endpoint in Oaks, did not meet the primary endpoint in Derby. Pegcetacoplan demonstrated greater efficacy in patients with extrafoveal lesions at baseline, and pegcetacoplan did reduce lesion growth in an analysis of the study eye versus the untreated fellow eye, supporting primary analysis. Overall, pegcetacoplan administered monthly or every other month was well tolerated in patients with geographic atrophy. Thank you.